Hello, everyone. Mike Mosquito and Maureen.
Nylene.
We're here on location still at ViVE 2026 in Los Angeles, California. We're back on our live set today, and we've got Peter and Micca from Caduceus Capital Partners. Peter, thank you for joining us on the show.
Thank you. This is incredibly exciting. It's a big difference from the snow in New York. I can tell you right now. So we're happy. Our team's happy to be here.
Well, I was so excited to meet Peter. We met through LinkedIn. It's the power of LinkedIn. You never know who you're
Absolutely.
going to run into.
Yeah.
We had a great conversation last week. He said, "Hey, I'm going to be at ViVE." And I said, "So are we." And we said, "Let's make a plan to get together and we'll chat." And so
Fantastic.
I want you to tell the audience a little bit about yourself and your
Yeah,
background.
no, we really appreciate the opportunity. We love being out here. Look, this is next chapter for me. I spent a career at Deloitte, founding, building, and scaling our focus on emerging health technology companies and really the future of health. Had an opportunity and joined an investor group, which was a partner in. And, our view simply is that it takes more than capital to scale a business,
Yeah.
right? I mean, you see a lot of capital formation here, but the reality is you need to understand who your customer is. You understand how you get your product to market in today's environment, faster, better, cheaper.
Yeah.
And so 7 partners, a mosaic of talent from clinical to banking to finance to operational. We all kind of know our swim lane. We do things differently. We like to really get involved in our companies. We spend a lot of time curating a relationship. We think personally that in a world where technology is ubiquitous, that channel partners, relationships
Yeah.
matter and are really the most, or increasingly are a more important part of the overall value of a company.
Yeah.
And so we spent a lot of time getting to know our founders and CEOs and kind of understand why are they doing this, what got them into this, what's important to them, what's important to their family. And so, look, we're bullish on people. We think people are a differentiating factor in technology.
Yeah.
Well, tell me what's at the top of your portfolio, because this is a timely discussion between us and what's happening. We've got conferences. This is conference season.
Yeah.
And people want to know, hey, I've got a business out there. What's at the top of your portfolio
Yeah.
of investment?
So look, our thesis is very simple. We think in an ever-changing world, anything that brings healthcare closer to the consumer and engages the consumer is going to be valuable, right? Most people don't complain about the quality of their physician. They complain about access points,
That's
how
right.
they access it, when they access it, and the convenience around it. We believe, because of the macroeconomic conditions, that a lot of rural hospitals, frankly, are just going to go out of business.
Yeah.
And they won't be acquired by larger health systems.
Because they're not profitable.
Exactly. And it all comes down to the reimbursement. And in many cases, it's cheaper to use technology, remote patient monitoring, telehealth, and other capabilities. And frankly, buy a helicopter, okay, and have a heliport for high triage cases in certain geographies. And so we love innovation and technology that brings healthcare closer to the consumer in a really meaningful way. One of our portfolio companies in particular, Repario Health, just signed an exclusive arrangement with Amazon One Medical to kind of deliver their product into the market. We believe that channel partnerships in today's economy and today's technology is just as important, if not more so, than the actual technology. So when we value a business, we look at the company's ability to have have channel partner arrangements with traditional market incumbents that get their product to market in a quicker way.
Why do you think those channel partners are so much more crucial now?
Well, because look, I mean, the reality is, with new innovation and technology on the digital side, we don't invest in anything that requires FDA approval. But on the digital side, which is what this conference is about, you get 3 smart people from MIT and they can replicate an AI model, right, in 2 months, right? So how much value is really there, right? And I'm not oversimplifying the technology market.
Yeah.
Technology is the ticket into the dance.
It is.
Right.
Right.
And you need a go-to-market strategy that's important. It recognizes that certain traditional market incumbents have advantages at scale. And look, you looked at OpenAI and NVIDIA, right? They had a go-to-market. And those are the big players, right?
Big boys.
Even the big boys, recognize they need help, right? You have what I don't. I have what you don't. I could buy or I could build.
Or
Maybe we should just do it together.
Yeah, yeah.
Right.
But I think that's important because at the end of the day, there's a lot of people that don't have that mentality, though.
Well, I think those that don't won't survive.
Yeah.
And they won't scale.
Yeah.
And the reality is, investors are looking for. They're not looking for point solutions. They're looking for integrated solutions to complex problems. And those organizations need to think about how they bring their product to market.
Right. I mean, you're 100% right. How much did you invest in building the product? Now you got to think about, how do I get it to the people that are going to buy it, right?
Yeah.
And so at scale, yes, it's great when it's a pilot group and you get your first 100 customers. When's the first 10 million? How do you get to that? They had the commas and zeros.
Yeah.
And so that channel is very important. I remember when I started my career, I had the pleasure of managing all of the channel partners. I never got rid of that job. But I learned a very valuable lesson.
Yeah.
And that it's better to go together than you try to figure out how to do what they've already figured
And that's
out.
been a trend. It's been a few years now. I think it's more pronounced now because investors are looking for a path to profitability.
Yeah.
The go-go days of the COVID era are kind of over.
100%.
In terms of access to capital, companies are looking for real profitability, scale, in how you bring a product to market.
Do you think that will become a growing trend of that capital shrinking? Do you see that being the foreseeable future? That's where this industry is going for bringing products to market.
Our view is that the level and pace of innovation is going to increase. The question is, where does it come from? Does it come from traditional market incumbents who now stabilize their organizations and want to invest in innovation? Does it come from emerging growth companies, the way it has in the last 4 or 5 years? We think that mix may change, but the overall level of innovation is going to increase. And the numbers prove it. The capital formation is increasing every year.
All right.
If you take out the year and a half of COVID, it's been a hockey stick line, over the last 10 years. And we see that continuing, largely because the consumer's demanding it.
Yeah.
Okay. There's a level of consumer, a lot of it is, just focus on the demographics. Baby boomers are, very demanding. They want what they want when they want it, and they've got the money to buy it.
Yeah.
Right.
Yeah.
As a totality. Now there are issues of reimbursement, for on Medicare and Medicaid. They're putting a lot of pressure on providers. We're going to enter likely a period of austerity where certain organizations will have no choice but to adopt technology, or they won't survive.
Yeah.
I agree. I mean, we see this with technology we touch on the show.
Yeah.
And where people will come on and they'll have a great product, but they got to see beyond, we just launched our product, right? How do we get to that scale? How do we get to the right people, the right POCs, and beyond?
Yeah.
We see it a lot. I had a conversation with a founder about 20 minutes ago, and it was pretty evident that he was in love with the technology, but didn't really have an appreciation for the problem that the organization was solving.
Yeah.
And so when we look at investments, it's the very first question: what problem are you solving? You'd be surprised how many founders immediately go to, well, let me show you my technology. Let me show you how it works.
You know what? I'm not surprised by that because all too often, and I'm a nurse by background. I think I had
Absolutely,
shared that with you. It's so common that we would have someone in the health system come to us and say, "We need this solution," and they would point to it. Okay, but what problem are you trying to solve for?
Yeah.
We want to jump to the solution. We want to go straight to that bottom line and say, this is it. But that may never address the issue because it might be a people or a process issue, and plugging in another solution is only going to add to the complexity. It's not going to decrease it. And so I love that you are having those conversations with the founder because, as you say, it could be a great product. That doesn't necessarily mean it's going to be able to succeed.
A fairly significant number of our limited partners in our fund at Caduceus Capital are actually healthcare providers and healthcare organizations. And so it's not uncommon for us, as we're doing due diligence on a company, to share the organization with one of our limited partners, the CIO of a health system, and say, hey, would you buy this? Is this solving an issue that you're dealing with? And if the operator says, not really, or it needs to change, or this needs to occur, we'll use that information as, in our investment thesis as to whether or not we're looking at an organization.
That is a true litmus test. I remember sitting on an advisory board some years ago, and we're sitting around. There are 12 CIOs, CDIOs sitting in the room on the solution, and they're being kind of quiet, not wanting to bust the bubble that's sitting above everybody's head.
Quiet isn't always good.
I know.
Right. That's what I do then. I'm like, this awkward silence is not because they're thinking about what the purchase is going to look like. And so I'm like, you know what? Let's just rip this Band-Aid off. How many of you sitting around this table right now, my job is to facilitate this. How many of you would buy this solution? Candidly, let's tell these guys what they need to hear.
Right.
Not a hand raised.
Yeah.
I said, what if the implementation was free?
Right.
Crickets.
Yeah.
I'm like, is there more you need to hear? They bought the company anyway. $7.X million later.
Yeah. Well, what you're talking about is value, right? And so if people value, it's like anything else in life. If you value it, you'll pay for it.
Yeah.
Right. And if you don't, you won't.
Yeah.
And so big part of our thesis, we think you have a clinical background, right? We think one of the challenges, many challenges in the healthcare system, but we think the most significant is that we're not engaging the key participants in the system, which is the consumer, the patient, and the physician.
Yeah.
Right. And we're not giving physicians the information they need to make informed decisions. A lot of folks talk about value-based care. The reality is we don't pay physicians that way. They get paid like a car mechanic. The more they do, the more they get paid.
Yeah.
It's not a criticism of physicians, it's a criticism of the system we've developed.
That's right.
A part of it's the data and the information, which gets back to our thesis around bringing healthcare closer to the consumer. We like tools that give physicians what they need to create better outcomes and a better experience.
Yeah. How do you select the people that you're going to work with? Because at the end of the day, you made a couple of really interesting points in that you'll have a founder that has a great technology and they want to jump right to the technology and this is what it solves for. And then you give them the feedback. This doesn't seem to be solving a problem that exists within the market.
Yeah. Well,
I'm sure people aren't exactly excited to hear that.
So here's a great example, right?
Yeah.
I mean, we run an accelerator. It's called Caduceus Launch. It's a much smaller version and more curated than Y Combinator or others.
Okay.
We'll bring a small group of founders, into our space. We'll surround them with our partners. We'll surround them with our hospital operators, healthcare operators, and we'll start the conversation with, look, this is the founders table.
Yeah.
This is not the CEO table. Meaning, you may not be the CEO of this organization. You're the founder. You're still going to be here, but a big part of leadership is understanding where the gaps in your go-to-market strategy are and the talent that you need. We spoke earlier about we believe that it takes more than capital to scale a business, which is why we created our launch accelerator, which is why we created a talent platform. We have a lower cost alternative for emerging growth companies to access talent using technology in a very significant way, because we believe some of the larger organizations aren't focused on emerging companies. And we've built out an advisory business that focuses on connecting emerging technology to healthcare organizations, sift through the noise of point solutions, help them kind of prioritize what they want. A lot of healthcare organizations aren't investing off their balance sheet. They don't have a venture studio. They don't have a team that's looking for innovation. They try to figure out, how do I answer the question of AI? Where do I place bets? How do I make investments? And so the healthcare organizations that we work with, they view us as an outsourced innovation arm. And so we're constantly sensing the market for the solutions that they need. Sometimes it's a bundled package. But we'll do an assessment for, healthcare organizations, say, like, what are your top 3 problems?
Yeah.
Do you need care navigation, discharge planning? You need a technology solution, not just advice.
Yeah.
Let me ask you this, Peter. So for organizations, we know Mayo Clinic, Cleveland, all these guys have venture arms out there, right? So if there's an organization out there that they're like, you know what, it's time for us to stick our toe out here. Instead of spinning up a venture on from ground up, they can come to you guys and
Right.
partner with you.
Many of the I'll say middle market healthcare organizations look at us that way.
Yeah.
Very
Right.
nice.
They look at us as an outsourced innovation partner. And the economics work and align incentives in a way
Right.
for us to find the right solutions that they want in the market.
You guys partner on it?
And we have a number of other more significant healthcare organizations that invest in our fund because they're always looking for innovation too. That hockey stick of innovation and investment is not going to stop.
Yeah.
It's not. Either you get on board and understand that it's changing things in a very rapid way, or you're not going to survive.
Yeah. Well, how can people learn more about Caduceus Capital?
I mean, we put everything out in the open. We're high disclosure. Everything's on our website.
All right.
We put all our portfolio companies there, our investment thesis, what we do and how we do it. The application process for Caduceus launch is now open. We're running it in April in Nashville, Tennessee.
Very nice.
Take a look. If you think it makes sense, apply. We'll obviously look at your innovation.
Very nice.
Right.
Peter, thank you for joining us on the
Thank you,
show
man.
today.
Fun.
Appreciate you guys.
Awesome.
Thank you.
Yeah.
Thank you very much.
Yeah.
Thank you.
We've got Peter Micca here on the show with Caduceus Capital Partners, talking about how they're actually bringing products to market through their venture fund and actually educating these founders on what does it look like to really bring a product and service to market in this healthcare landscape. Again, it takes a lot of brain power to do this, one, to bring a product even to light, but also to make it a company. We like having these type of conversations with Peter and others on this show. We hope you like and subscribe on thebuzzpodcast.net. Maureen and I'll be on location the rest of this day, trying to gather more voices like Peter's. And until next time, we hope you enjoy and we hope you keep buzzing.